empathetic social system for managing vulnerable Nigerian citizens in categories identified by establishing robust policy and effective organizational structure to promote an inclusive society that regards the dignity of all by supporting the vulnerable in sustainable ways to contribute as much as possible to national human development, economic productivity, social participation, peace and cohesion, and inclusive growth. The bill seeks, amongst other things, the establishment of a just and equitable system for the coordination and implementation of social security and intervention of Nigerians by adopting a systematic and harmonized mechanism to identify eligible beneficiaries, exchange of information with social system, execute, monitor, and evaluate the social impact at various levels of interventions. When established, the Commission shall keep and maintain an up-to-date national database, data bank, and statistics of vulnerable persons or groups in need of support from governmental and non-governmental interventions in social security and administration. Finally, if passed into law, shall put in place a robust, efficient, and transparent, sustainable, and predictable national social security protection funding system. Executive summary of the bill. One of the cardinal policy thrusts of the administration was the provision of social security intervention to indigent and less privileged Nigerians across the board. Unfortunately, the extant federal government social security programs are not properly articulated, coordinated, and implemented due largely to the absence of an effective legal and institutional framework. Hence, the desired societal impacts and results arising from have been minimal and far from satisfactory. This is a well-researched effort aimed at putting in place an effective and efficient legal and institutional structure that will regulate, coordinate, manage, implement, monitor, and evaluate all national and subnational security interventions into harmonious whole with a view to archiving social inclusion and economic empowerment for the vulnerable Nigerians. The bill has received tremendous support and commendation from the general public during the public hearing. The committee hereby found the bill to be timely and important to the socio-economic well-being of Nigerians. The respective provisions of this bill have been analyzed and thoroughly considered in the light of relevant submissions by the stakeholders at the public hearing. Hence, this report is an embodiment of all the relevant inputs and contributions which the committee considered to be of immense value and importance. The clean copy embodying the relevant provisions of the bill as recommended by the committee is hereby attached for consideration. Accordingly, the Committee on Establishment and Public Service hereby recommends that the Senate do consider and pass the bill for an act to establish the National Social Security Commission for regulation, management, and administration of social security benefits and service, and for other matters connected thereto, 2022. Mr. President, my dear colleagues, the committee hereby expresses its profound gratitude to the Senate for being given the opportunity to serve in this capacity. I thank you all.
I move that the Senate do resolve into Committee of the Whole to consider the report. I so move.
Distinguished colleagues, those in favor that clause 1 to 10 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 11 to 20 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 21 to 30 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 31 to 40 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 41 to 50 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 51 to 60 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 61 to 70 stand part of the bill say aye. Those against say nay, the ayes have it. Those in favor that clause 71, clause 72 stand part of the bill say aye. Those against any, the ayes have it. Those who are the interpretation stands part of the bill say aye. Those against any, the ayes have it. Those who are the short title on page 24 stands part of the bill say aye. Those against any, the ayes have it. Those who are the schedule on page 24 stands part of the bill say aye. Those against any, the ayes have it. Those who are at the explanatory memorandum stand part of the bill say aye. Those against any, the ayes have it. Those who are at the Senate reverse plenary for the charity report progress say aye. Those against any, the ayes have it. The Senate and the Committee of the Whole consider the report of the Committee on Establishment and Public Service Matters on the National Social Security Commission Establishment Bill 2022 and approved as follows. Long title as recommended, clause 1 to 72 as recommended, interpretation as recommended, short title as recommended, schedule as recommended, explanatory memorandum as recommended. Is this a true reflection of what transpired in the Committee of the Whole? Thank you. Those in favor of the motion that this will be now read the third time, say aye. Those against, say nay. The ayes have it. Clerk of the Senate.
A bill for an act to establish the National Social Security Commission, NASCOM, for the regulation, management, and administration of social security benefits and services and other related matters, 2022, third reading.
A bill for an act to establish
Nephrology and Kidney Research and Treatment Center, Hadeja, Jigawa State Establishment Bill, sponsored by Senator Ibrahim Hadeja, passed second reading.
Order of the day is the second reading of the Federal Nephrology and Kidney Research and Treatment Center, Hadeja Establishment Act, Bill 2022. Distinguished senators will recall that the bill was read the first time in this chamber on Tuesday, 10th November 2020. Mr. President, you may wish to invite Senator Ibrahim Hadeja to move the motion for the bill to be read a second time.
This is a lead debate on a bill to establish the National Nephrology and Kidney Research Center, Hadeja, Jigawa State, and for other matters connected therewith, Bill 2022 SB 385. Mr. President, my distinguished colleagues, permit me to lead the debate on the subject bill which was read for the first time on Tuesday, 10th of March 2020. Mr. President, chronic kidney disease, or CKD, has become a major public health problem in Nigeria, with some estimates putting prevalence at around 20%, or 6% higher than the African average, translating to an estimated 25 million Nigerians suffering from the disease. The figure could be much higher if misdiagnosis and undocumented informal or traditional treatment is taken into consideration. Leading causes include untreated hypertension, diabetes, exposure to certain toxins found in industrial reagents, water contaminated with heavy metals, and runoff from toxins and chemicals found in agricultural inputs. The problem is particularly dire when one considers that Nigeria has one of the worst variables in availability and affordability of dialysis and advanced CKD treatment availability in the world. Over the last 12 years, there is a noticeable escalation of CKD and outright renal failure in the Hadeja area of Jigawa and parts of Yobe, and preliminary studies commissioned by the state government confirmed this about 5 years ago. Outside the usual causative factors, it's very likely that the contamination of groundwater by agricultural pesticides and chemicals following the exponential expansion of rice cultivation is to blame. And the high water table in the region makes the ground and river water, which is the only source of drinking water in the area, particularly susceptible to leaching and runoff. Another study conducted by NARICT, that's the National Research Institute for Chemical Technology area in 2015, confirmed the abnormally high incidence of CKD in the Hadeja Valley with a prevalence that is 3 times the national average. The study also confirmed the presence of heavy metals and other environmental toxins in the water supply and in the sample liver of local livestock and poultry. The National Agency for Food, Drugs Administration and Control, NAFDAC, has also reported very high concentrations of cadmium and lead in samples of drinking water from the area, ranging from 0.07 to 0.20 ppm and up to 0.30 ppm for cadmium and lead respectively. Almost all these elements are nephrotoxic in nature. Yet again, in 2021, the Federal University Dutse got a 36 million grant from TED Fund to undertake a research titled Rampant Kidney Disease in Hadejia Valley, Yobe and Kano states, following the alarming statistics derived from hospital records in Jigawa and environs. Findings from at least 3 of the concluded research projects confirm a CKD incidence that is between 300 to 500% of the national average. And there is no dedicated renal center in both Jigawa and Yobe states, although there are dialysis facilities in the federal medical centers and some general hospitals that are absolutely overwhelmed by renal patients. CKD sufferers are therefore forced to go to Kano, where the situation is also dire, with instances of only 8 out of 20 dialysis machines working in AKTH and 4 out of 6 in Wase Hospital, leaving only private facilities where the unsubsidized cost is almost 5 times that of the government hospitals. The Jigawa and Yobe state governments offer free dialysis in government hospitals, and there is even a donor-founded dialysis center in Hadejia that heavily subsidizes the procedure, but the waiting list can stretch to months because of the deluge of patients. The scenario range, which can cost as much as 300,000 naira a month without cost of drugs. So a diagnosis of end-stage renal disease is as good as a death sentence for anyone diagnosed with end-stage renal failure in these areas. Mr. President, my distinguished colleagues, this is why the siting of a kidney research and treatment center in Hadejia becomes imperative. There is an urgent need to locate a center of excellence dedicated to establishing the causative factors and treatment options in the renal disease epicenter of Nigeria for the benefit of kidney disease patients nationwide. The interest generated by concerned experts in the field and the preliminary results of the various investigative and research endeavors justifies the urgent call for the involvement of the federal government to intervene in halting an endemic situation and save thousands of lives lost to an otherwise avoidable or manageable medical problem. The center, as envisaged, will not only focus on identifying and dealing with the causative factors, but indeed address the issue of affordable treatment regimens through early diagnosis, treatment, and management before the prognosis becomes end-stage with dialysis or transplantation as the only options. Kidney disease is treatable and reversible if identified at an early stage, but the absence of nephrologists, dialysis nurses, and specialized equipment, as well as adoption of preventive measures and a novel treatment approach that only a dedicated center can provide, means certain death for a majority of the patients in the epicenter of the CKD pandemic. In line with Order 76.3 of our standing orders, the financial compendium of this bill is hereby attached. I urge my colleagues to support this bill so that kidney disease in Nigeria can finally get some focused federal attention in line with the global best practice approach to renal disease. Thank you very much, Mr. President.
I rise to second that this bill be read for the second. Kidney disease is a very serious matter in this country. And from the statistics, it interests you to know that we are merely 109 here. And going by that statistics, and if you do a test, you'll be shocked. And that's the reality in the country today. Very, very epicenter for this disease. Therefore, establishing a kidney center that will carry out research that will not only focus on treatment, but on prevention, which is key in modern medicine today, will not only help this area that are most affected, but will help the whole